Welcome to the Elder Abuse and Neglect, Prevent, Recognize and Report Training. Produced by Jan and Bev's Home Care for Personal Care Aid in Service Training. After this training, you will be able to define different kinds of abuse. List ways to prevent abuse and neglect. Identify symptoms of caregiver stress that could lead to abuse or neglect. Recognize signs of abuse and neglect. And know how to report elder abuse and neglect. The typical elder abuse victim lives with and depends on a family member for daily care. But abuse is also a problem in the in-home care industry. Most elder abuse victims are female, age 75 or older, with a mental or physical illness. Most elder abuse victims are completely dependent upon their abusers. Most abusers are relatives who take care of the elderly person. They may have problems such as drug or alcohol dependence, emotional or mental illness, or stress. Many times, the abusers need as much help as their victims. Caregiver stress can be a problem for anyone caring for the elderly, and this can lead to abuse in the in-home care industry. Complete the Are You an Overly Stressed Caregiver questionnaire in your in-service folder to find out if you have signs of excessive stress. This questionnaire can be used for family caregivers as well. You can help prevent elder abuse and neglect by listening to your clients and their caregivers, intervening when you suspect elder abuse or neglect, and educating your clients and their caregivers on how to recognize abuse and neglect. As a professional personal care aide, you have valuable skills in caring for the elderly. You can also teach these skills to your clients' family members. This will help your work be less stressful, and will prevent both you and their family members from unintentionally abusing or neglecting your clients. You can also help family members by listening to their frustrations and working together to solve problems. And we must always remember to respect our clients' rights at all times, and educate their caregivers about their rights as well. As our population ages, the elderly become frail and may suffer hearing and vision loss and become unable to think as clearly as they once could. This leaves them open for unscrupulous people to take advantage of them. Types of elder abuse include physical abuse, emotional abuse, sexual abuse, neglect and abandonment by a caregiver, financial exploitation, and healthcare fraud and abuse. You should be concerned if your client becomes withdrawn, unusually quiet, depressed or shy, anxious, worried or easily upset, or if your client refuses care from caregivers, or does not want to be around people. These are all general signs of abuse. Unexplained burns, cuts or bruises, sprains or fractures, unreasonable or inconsistent explanations for injuries, frequent emergency room visits, caregivers refusing to allow the nurse to see the client alone, clients refusing to be seen by a doctor for wounds, and in women, vaginal bleeding or bruising of the genitals or thighs are all signs of physical abuse. Belittling, threatening, or controlling behavior by the caregiver in your presence is a sign of emotional abuse. Other signs of emotional abuse include behavior from the client that mimics dementia, for example, rocking or mumbling. Client becomes withdrawn or frightened. Client is depressed, confused or has lost interest in things previously enjoyed. And client has difficulty sleeping. Signs of sexual abuse include torn or bloody clothes, especially undergarments. Sexually transmitted diseases, bruises, especially around the breast and genital region, and bleeding from the vagina or anus. Signs of financial abuse include items or cash missing from the home, withdrawals from bank accounts that clients cannot explain, a new friend who is helping with shopping or finances, missing financial papers, unpaid bills, utilities being shut off for non-payment or debt collector calls, and unnecessary goods, services, or numerous subscriptions. Signs of healthcare fraud include clients complaining about duplicate billing for the same service provided, and evidence that the client is over or under medicated. Signs of possible neglect include weight loss, malnutrition, or dehydration, insufficient clothing, shoes, or basic hygiene items, missing or broken dentures, eyeglasses, walkers, medications not filled or taken, doctor appointments not made or kept, unclean appearance or smell, skin ulcers or sores, missing medication, unexplained declining health, and unsafe living conditions. If you suspect that one of your clients is being abused or neglected by either a family member or another professional caregiver, you should first report your suspicions to the RN supervisor or to the administrator. If you know that an elderly person is being abused or neglected, you are obligated to notify the proper authorities. You should be familiar with any statements of rights that New York State has issued to protect home care patients. Ask the RN supervisor for a copy. Our local adult protective services deals with abuse and neglect of the elderly. To report elderly abuse or neglect to Adult Protective Services, call 585-268-9316. Thank you for completing this training. To finish the course, you must take the required test. You have two options. Scan the following QR code to access and complete the test online, or complete the paper test included in your in-service training folder. Please make sure your test is successfully submitted so your training can be recorded as complete. Thank you for your time and your commitment to maintaining safe, high-quality care.